Hey everyone, it's Timmy, and in this video we're going to go over the lung points and their locations. So the lung channel has 11 points total, and we're going to first go over the overall direction of how the lung points are arranged. The lung points start at the chest and end at the thumb, and so they start on the lateral aspect of the chest. It goes up, down to the lateral aspect of the biceps, past the inside of the elbow, called the cubital fossa, past the forearm, on the transverse crease of the wrist, past the thenar eminence, which is the muscly part of the thumb, and all the way to the radial side of the thumb. And so we're going to go in depth about each point's location. So first, we have lung 1, 中府, and it's on the chest, level with the first intercostal space. So that's the first space between the first and second ribs. And it's going to be level with that. So horizontally, level. And it's going to be 6 twin lateral to the anterior midline. So the anterior midline, 6 twin. An easy way to find 6 twin lateral to the anterior midline is directly below the protrusion of the coracoid process of the scapula. And so the coracoid process of the scapula is kind of like this little bone coming out laterally this way. And so if you feel for underneath the clavicle, there is a prominence below the collarbone that is the coracoid process of the scapula, right here. And if you go right below it, that will be 6 twin lateral to the anterior midline. Now, lung 2 will be really close. In fact, in some definitions, is 1 twin superior to lung 1. So lung 2, yunmin, is on the chest, in the infraclavicular fossa, which basically just means below the clavicle, and fossa just means space. So the space below the clavicle, 6 twin lateral to the anterior midline. So again, you're going to find where the coracoid process is protruding out, just go right above it. And so lung 1 and lung 2, lung 1 will be right below the coracoid process, and lung 2 will be right above the coracoid process. Lung 3 is tianfu, is on the lateral aspect of the upper arm, and it's lateral to the biceps brachii, which is just the biceps muscle, 3 twin inferior to the axillary fold. And so that's just the armpit crease. A really helpful measurement to know is that the distance between the axillary fold, the armpit crease, and the cubital crease, which is the elbow crease, that is 9 twin total. So if you divide that 9 twin into thirds, that's 3 twin, 3 twin, and 3 twin. So if you go a third below, that's 3 twin, and you'll find lung 3. The next point is 1 twin right below it. So lung 4, xia bai, is also on the lateral aspect of the upper arm. It's lateral to the bicep muscle again, and 4 twin inferior to the axillary fold. Or you find lung 3, and you go 1 twin inferior. And that's lung 4. Lung 5, 尺泽, is on the cubital crease, radial to the tendon of the bicep muscle. And so you want to find this point with your elbow slightly flexed, and you're going to go radial to the tendon, which is towards the side of the thumb. So that's lung 5. Lung 6, 孔最, is on the palmar aspect of the forearm. It's on the line joining lung 5 and lung 9. Lung 9 is on the wrist crease. And so it's on the line joining lung 5 and lung 9. 5 twin distal to the cubital crease. So we'll just take a pause on lung 6 for now to look at lung 9's location. So lung 9 is on the transverse crease of the wrist, on the ulnar side of the tendon of abductor pollicis longus. So if you look at your wrist, you'll notice that there is a depression right here. If you go towards the side of your thumb, you'll notice the tendon there. That's going to be the tendon of abductor pollicis longus. And so you're going to go ulnar to that because radial is the thumb side, ulnar is the pinky side. So you're going to go ulnar to that tendon, and you're also going to want to make sure you don't puncture the radial artery. So basically between the radial artery and that tendon. So now that we got an idea of where lung 9 is, now we can look at lung 6 again. So remember, it's the line joining lung 5 and lung 9. So a really useful measurement here is the distance between the cubital crease and the crease of the wrist. That's going to be 12 twin total. So one way you can measure for 5 twin distal to the elbow crease is you find the halfway point between the elbow and the wrist crease. That's going to give you 6 twin, and you're going to measure 1 twin up. So that's going to give you the 5 twin measurement from the cubital crease for lung 6. Lung 7, 裂缺, is on the radial aspect of the forearm. It's in the groove for the tendon of M. abductor pollicis longus. So that's just the tendon that we just talked about. That depression there, and you go right next to it, that's going to be abductor pollicis longus. And if you go 1.5 twin proximal to the transverse crease of the wrist, you're basically going to go below that bony bump, going to be the styloid process of the radius. Right below that, you'll feel an actual groove. It's actually carved in your bone. That's the groove for the tendon of abductor pollicis longus. And if you measure 1.5 twin proximal to the transverse crease of the wrist, you'll find lung 7 right there. So lung 8, 经曲, goes back onto the main branch of the lung channel. It's on the anterolateral aspect of the forearm, and it's 1 twin proximal to the transverse crease of the wrist. So you can just measure 1 thumb width below the crease of the wrist. And 1 twin below, you're going to find the radial artery. And once you find where that radial artery throbs, you're going to go just a bit laterally, so towards the radial side of that radial artery, so that when you puncture the acupuncture needle, it doesn't enter the radial artery. Lung 9, 太原, is on the anterolateral aspect of the wrist. So it's actually on that transverse crease of the wrist. And once you find that depression, you're just going to, you'll find the tendon right next to it, which we talked about, abductor pollicis longus. And you're going to go ulnar to that, making sure not to puncture the acupuncture needle into the radial artery. Next, we have lung 10. 鱼际 is on the thenar eminence. That's just a fancy name for saying that mound of muscle on the thumb. It's at the midpoint of the first metacarpal bone. So that bone that connects to your thumb in your hand, that's the first metacarpal bone. And you're going to find the beginning and end, find the midpoint of it. And once you find the midpoint of it, you're just going to go towards the palm direction just a little bit to find the junction of the red and white skin, and that's where lung 10 is. Finally, we have lung 11, 少商. It's on the radial side of the thumb, and it's at the intersection of the vertical line and the horizontal line of the base of the nail. And so you'll find that it's basically at the corner of the thumb on the radial side. And that's where lung 11 is. And so in this video, we covered all 11 lung points on the lung channel. Thank you for watching. I'll see you in the next video.